This episode is very exciting, Dr. Raban, because we're going to be talking about men getting plastic surgery on Plastic Surgery Uncensored. So later on, we're going to actually have a caller, one of your patients. But for right now, I want to get into the general topic. First of all, it's very taboo. Do men seem embarrassed or shy when they come in?
I mean, I think it's definitely still a bit taboo, but we've made significant grounds. There was a time where nobody would even mention it. I think that we definitely had made grounds because I can see that I could tell you maybe about 20% of my practice is men, which is up from, say, 5 or 10 years ago. So definitely there's an increase, but it's still one of those things that, guys don't feel comfortable. They certainly don't feel as comfortable as women discussing it with their friends or telling other people about it, for sure.
Here's what's interesting between males and females. Are the men more educated on it? Have they done more research? Is it like buying a car when they come into you?
Interesting. That's a good question. Actually, not anymore. I don't think that there's any more research oriented than the women. They tend to be a little bit more gun shy at the beginning because, of course, they have what is the number one fear a man has about having plastic surgery done, other than other people knowing?
I couldn't ask you.
Feminization. So
Mm-hmm.
feminization means what? It means that I'm going to go get plastic surgery done and I'm going to look feminine or like a woman. So, for example, I have a huge nose and I want to fix it, but I don't want to look girly. I have saggy eyelids and I can't even see, but I want them removed. I don't want to look feminine. So you can understand that the fear for a guy is because guys are rugged. They're supposed to have scars and blah, blah, blah. So they're, so many women say, I don't like pretty boys because there is something about the ruggedness of a man that is considered attractive.
You want him to look manly.
Manly. So their biggest fear is feminization. So they tend to be a little more reluctant at the beginning and maybe a little more apprehensive. But as far as research, I don't think there's any more. They do any more.
They're not any more prepared.
No,
they don't know any more of the truth.
No.
Okay.
Everyone is universally as unaware.
So you say 20% of your practice, are they all close to the same age? Are they different ages? Do they come in? Like, I'd be curious to know what a 20-year-old man, as we're going to speak to later, a young man, men in their 30s and 40s, 50s and 60s. So
Sure.
they're like age brackets.
Yeah. I mean, listen, obviously, people come in at different times in their lives needing different things.
Mm-hmm.
So younger men come to the practice, and usually they do the following procedures. Rhinoplasty, for example.
Mm-hmm.
Chin augmentation is huge in men because we expect,
weak
obviously, a very strong chin in a man.
Jaw? Do they do jaw?
Jaw as well, but jaw is a very complicated surgery. But chin augmentations, rhinoplasties, and say some gynecomastia or male breast tissue that they remove, which kind of goes along with liposuction. Those are like the collective group of things. Maybe you throw in an ear pinning at the time of because men wear short hairs and they can't, if their ears are prominent, they can't hide it like women can with their hair. That's the initial years. As you get a little bit older, men start to change gears and start to pay a little bit more attention to their face, and they start having issues with eyelid excess and not being able to see, neck excess or the turkey neck, and then perhaps need a facelift. And men start to do facelifts in their 50s and on because, of course, remember, they're in the workforce like women, and younger tends to be perceived as more desirable in terms of in a competitive environment. And then across the board,
Mm-hmm.
men are doing. There's a huge uptake in the sort of non-surgical or injectable arena. Botox and filler is probably where we see the greatest increase in male patients because it's something that is sort of like a gateway or an entryway. It's, reversible, it's quick, it doesn't have a lot of downtime. And so as a result, we have a lot more patients doing that.
So you mentioned gynecomastia. Did I say that right? Gynecomastia? Is that what it
Great.
is?
Yeah, gynecomastia.
Yeah, thank you.
Good job.
Because I call it moobs. I'm not in the habit, man boobs. What exactly? I've known 2 men that have had that removed. Now, first of all, is there an uptick in gynecomastia? Are more people having it than in the past? I don't remember so many moobs in the world.
Yeah.
And then number 2, what do you, do you get good results?
So listen, man breast tissue or gynecomastia for a man is almost equivalent to losing your hair. I mean, in terms of the amount of insecurity it generates. I have seen incredibly good looking, built, like guys that you would think would have incredible confidence say that, I don't even take my shirt off in front of my wife or my girlfriend.
Wow.
So it's really a psychologically challenging physical issue. So what is it? Essentially it's male breast tissue. So all men have breast tissue 2% of all breast cancer occur in men. So the fact that they have breast tissue isn't an issue. But for some reason, the amount of breast tissue in that patient tends to be more, therefore creating kind of a breast-like mound shape. And it varies into a small amount to some really sizable. So the causes of it are, of course, idiopathic, which means unknown. There are men who actually it's genetic, like their dad had it, their grandfather had it, and they have it. There are hormonal issues, feminization, like hormonal imbalances, pot, big time. So
really,
smoking
marijuana
pot, yes.
really does.
I can tell you there's going to be an uptick in gynecomastia surgeries ever since the legalization of pot.
So there's a straight line from marijuana to moobs.
Now you go from Mad Men to Dr. Raban. It's just that we'll just get a shuttle.
Okay.
So marijuana causes increased amount, and then steroids. So we see a lot of athletes who have gynecomastia because it changes the balance of the estrogen and testosterone. So, and the treatment for it, of course, is removing the breast tissue, whether that be by liposuction and or directly cutting it out, sort of like a mastectomy type thing. And the results are amazing. They can be very, very good.
Now, do people deflate? Like when you say athletes, when guys get, because I mean, I recently saw a picture of, God bless him, Arnold Schwarzenegger. Do men get like saggy boobs like women when they were once really plumped up and big and then they deflate?
Yeah.
That's different from gynecomastia.
Totally
though.
different. Yeah, exactly. So gynecomastia is breast tissue.
Right.
And what you're referring to is breast sag because, say, for example, Arnold, at some point, if you look at his photos when he was in his 20s, I mean, he probably had a D-cup breast in volume. Right. And now he's an older gentleman and his skin and his muscles have atrophied and he's got the excess skin. So one is the sagging of the skin and one is the excess breast tissue.
And you can do surgery for both.
Correct. You can. The gynecomastia, the scars are almost invisible. The breast tissue removing is similar to women. You got to remove it in a similar pattern, whether that be a donut or a lollipop or an anchor. You got to remove it in a similar fashion.
Those are the scars. And with the sagging of the chest after maybe an athlete's lost weight or deflated, what kind of scarring can they expect?
That's as I said. It's going to either be a breast lift.
Oh, got it.
So it'll be a donut or a lollipop or an anchor in. So it's similar.
Excellent. So we're going to actually have one of your patients on to discuss what you did, and he was in his 20s, so he didn't actually have surgery. This is exciting. He wanted to look better as a young, good-looking guy, and you were able, when we come back, to do some stuff for him. So I'm excited. We're going to get Jeff on the line.
Yeah, me too.
You are listening to Plastic Surgery Uncensored with Dr. Roddy Raban on Revolver Podcast. So on this episode, I'm so excited, Dr. Raban, that we're going to be talking about male plastic surgery on this particular podcast of Plastic Surgery Uncensored. I can't get over how much I love that title because we're going to be talking to men, a man in particular who is one of your patients. And this is one of those things that men don't want to talk about. So thank you, Jeff, for being on with us on Plastic Surgery Uncensored. And first of all, what did you have done, Jeff?
Yeah, glad to be here. Thanks for the welcome. So I had injectable fillers for my under eye area, cheeks, and nose bridge. Can let Dr. Raban perhaps talk a little bit more in depth about the technicals behind it, but really trying to address dark circles under my eyes and then nose shape. Yeah,
so that's actually a great description, and I think Jeff is a prime example of an individual, young man, very good looking, in the workforce. And, when women don't like the way they look, it's pretty it's pretty expected or never questioned about doing things about it, whether that be makeup or et cetera. But when men have things that they don't like, often it's as we always say, it's a little bit taboo. But that's no longer the case. And we have actually my patient population, I would say about 20%, which is quite high, are men in different phases in their life. And what Jeff did was, he came to me and his biggest concern was just by anatomy. And he's a young man. He's healthy. He's in great shape. But just his anatomy was that he just was very hollow under his eyes, in the middle of his face. And it made him look older. And he would always have people say, "Oh, I look so tired. I look so tired." I'm not really that tired. And additionally, he came in, we were talking about a rhinoplasty because, he's got a little bit of a larger nose and a hump. And I had suggested to him, as I do with every patient, I always try to find the path of least resistance. In other words, how can I get you where you want to go, maybe with the least amount of cost or risk and still get you an equally good result. And we talked about possibly doing what we call a liquid rhino. So what Jeff had done was basically we filled a liquid rhino. We filled the area of his nose that in order to make his nose look straight, which works incredibly well. And we also did filler volume replacement under his eyes, in his cheeks, which essentially made him come to life. And I'll let Jeff describe, how he felt. And could you tell us a little bit about your experience?
Yeah, definitely. So I guess this was a couple months ago now, back in July, that we had this done. Things have been great since then. Just a couple main benefits would be on the emotional side, just having more confidence.
Were you nervous?
And not too nervous, really. I mean, I think it's a relatively minor procedure relative to something that's surgical, and it's also reversible, for worst case scenario or something. So that's one of the benefits I think that I thought about going into the injectables. But of course, researched Dr. Raban quite extensively, had the consultation, and felt pretty comfortable with his hands, I guess.
Jeff, let me ask you a question. You were alluding to, I think, which is really the underbelly of all of this. So how did it affect you? So now your dark circles are gone, your nose is straight, and your cheeks are fuller. So what? But how did it impact you on a day-to-day level? Because I think that's really why we're all doing this, right? The conversation isn't, oh, I look better. The conversation is, I feel better. So tell me a little about that.
Yeah, definitely a lot to talk about there. So I think going into this, one of the main reasons I wanted to do it was building relationships with people and just thinking about from a work perspective, friends, and dating, I think are the three different areas. So I'm in a field where I work in management consulting, which requires me to go onto a new client every 3 to 6 months, meet new people, and it's often in an environment that the client's not necessarily as receptive to you being there because you're making changes. So if I'm looking unfriendly or grumpy or mean or whatever interpretation of tired is, it makes it actually more difficult to build relationships with the
Interesting.
clients.
Wow. So you feel like if your liquid rhino and the other things that the doctor did, they not only gave you confidence, they made your face friendlier, more approachable. It sounds like warmer. I mean, it sounds like you feel more comfortable in your face. Yeah,
both things. I think it's the internal confidence that you get from looking at yourself in the mirror and just knowing that you look better. And then also actually looking better and more approachable. And actually, I was in business school the last couple of years, and part of that experience is a leadership coaching program. And some feedback that I got from my peers in my squad group of 5 people was that I actually didn't seem very approachable in my first impressions that they had of me, which was a survey that was taken immediately after meeting me. So I think there are other aspects there besides my appearance, perhaps, but I am a little shy. But I think certainly looking tired doesn't make you approachable and look friendly.
How obvious was it? And what did they say? What was the feedback from people when they saw it?
Yeah, so I think actually the nice thing about this kind of treatment is it's not, and this is what Dr. Raban had said going into it, is it's not something where someone's going to say, your eyes look better, because we don't necessarily remember specifics about everyone's face. But I've gotten a ton of feedback around, like, hey, have you been working out? You look tan, you look good, you look really refreshed. So a lot of comments around that from friends that they can't quite pinpoint what's changed, but you get a lot of
that's our goal, right? The goal is you look better, but nobody knows. Jeff, I had a quick question for you, because I think the subject matter is, and what we're trying to hone in, were you embarrassed? As a man, were you self-conscious about the fact that you were self-conscious? Were you embarrassed to tell anybody? And what do you think it's like for other guys who want to do stuff, but then they feel maybe ashamed?
Yeah, I think you're hitting on some good points there. It is more taboo, I guess, for a guy to get cosmetic surgery or treatment. And we also, I think you mentioned earlier, we have fewer options in like the makeup department because it's not as socially acceptable. So, definitely something that I was cognizant of going in, and I really haven't told many people even. I think there still is some of that perhaps shyness factor of it, but also the fact that, this is a treatment that people aren't really going to notice specifically, but they're just going to notice that you look better. So I guess that's one of the positive aspects of it. But I've told a couple close friends and showed them the before and after pictures as well, and the differences are pretty stark.
That's fantastic. And I'm really grateful that you're willing to share, because, there's a paucity of information from men, and we really wanted to hit this subject and discuss discuss it head on. And you really hopefully will inspire people to be willing to try things.
Yeah, definitely. I mean, it's your appearance, and I think that's an important factor. And if it can give you more confidence, which manifests benefits in work and friendships and dating and other aspects of life, I think that's a lot of, it's definitely worth it.
Awesome.
Congratulations. It sounds like you're feeling confident, competitive, and dare I say hot? Is that a good word, Jeff? Can I use hot? Is that too much? Is it too much?
Jeff's good looking. Jeff's a good looking dude.
All right. Great. Thank you.
All right, buddy. Well, thank you so much for joining us, and continued success.
Definitely. Thank you, guys.
It's been very eye-opening for me, because I think only women have insecurities, but you're telling us that men of all ages and stripes and situations come in now. 20% of your practice come in to discuss being better looking as men.
Yeah, and I think it's really important that we get this message out, because what it does is it confirms and encourages men to also participate in the process of self-improvement. Everybody
should look and feel their best. That's, I think, part of your message, but also not at the ignorance, and as you say, knowledge is power. So we're going to just wrap up, because that's a dude thing. Dudes like that kind of stuff, like knowledge is power. So we're wrapping up Plastic Surgery Uncensored with the very knowledgeable and very masculine.
Thank you.
Yes, Dr. Roddy Raban. If you loved Plastic Surgery Uncensored, and I'm sure you did, I don't even want to say if, we would love to get your feedback. If you enjoyed and found our podcast helpful, tell us why. Give us a review and subscribe on your favorite podcast platform. We can be found on Apple Podcasts, Google Podcasts, Spotify, iHeart, or you can go directly to revolverpodcast.com. If you have a topic you would like us to talk about, then please reach out to us on Facebook, Roddy Raban, Instagram at Dr. Roddy Raban, or RoddyRaban.com. You are listening to Plastic Surgery Uncensored with Dr. Roddy Raban on Revolver Podcast.